Artificial kidney, hemodialysis. Kidneys are vital organs for survival. Several factors like infections, injury, or restricted blood flow to kidneys reduce the activity of kidneys. This leads to accumulation of poisonous wastes in the body, which can even lead to death. In case of kidney failure, an artificial kidney can be used, which is a device to remove nitrogenous waste products from the blood through dialysis. Artificial kidneys contain a number of tubes with a semi-permeable lining suspended in a tank filled with dialysing fluid. This fluid has the same osmotic pressure as blood, except that it is devoid of nitrogenous wastes. The patient's blood is passed through these tubes. During this passage, the waste products from the blood pass into dialysing fluid by diffusion. The purified blood is pumped back into the patient. This is similar to the function of the kidney, but it is different since there is no reabsorption involved. Normally, in a healthy adult, the initial filtrate in the kidneys is about 180 liters daily. However, the volume actually excreted is only a liter or two a day because the remaining filtrate is reabsorbed in the kidney's tubules.